Repeal Obamacare, period. Obamacare cannot be amended, tweaked, or adjusted. Good evening, ladies and gentlemen. 2016 has been a very interesting political year. What I would like to talk about tonight is medical in 2017. The future of healthcare for the average American. Where are we? One step away from socialized medicine. That's where we are right now. How did we get here? Obamacare. How do we get where we need to go? Repeal Obamacare, period. Obamacare cannot be amended, tweaked, or adjusted. Here are just some of the reasons why. This is Obamacare. This huge monstrosity is still in effect with all of its taxes, its bureaucrats, its regulation. It is still in effect. It must be repealed. These things are bad enough, but what should be keeping you awake at night is Section 6301 establishes a patient-centered outcomes research institute. Establishment. There is authorized to be a nonprofit corporation to be known as the Patient-Centered Outcomes Research Institute, which is neither an agency nor establishment of the United States government. And that, ladies and gentlemen, is word for word right out of the law. Section 3403 creates an independent Medicare advisory board. The job of this board is to control the cost of Medicare. You notice there's nothing in there about the quality of health care. It's just control the cost. Let me give you a quote from the official Democratic Party talking points on government-controlled health care. The Democrats asked this question: I have heard that under the health care law, there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. The official Democrat answer: there is no such panel. This is a blatant falsehood. Section 6301, Patient-Centered Outcomes Research Institute. Section 3403, Independent Payment Advisory Board. Now, these two sections have interesting names, but they lack the panache of the English system, which is NICE, National Institute for Health Clinical Excellence. But make no mistake, ladies and gentlemen, these three boards all have the exact same job: to determine quality adjusted value of life. In other words, a bureaucrat will decide whether your quality of life is worth saving. Obamacare is like a cancer to Americans' freedoms. It must be cut out before it metastasizes. The pieces are all in place. We have a Republican president, we have a Republican House, and a Republican Congress. In short, ladies and gentlemen, all of the Republicans' excuses are gone. Now comes the hard part: keeping Congress from messing with the free market system. Well, that's kind of akin to finding a unicorn, winning the lottery, or finding a pot of gold at the end of the rainbow. In other words, we cannot really expect that to happen. Perfection would be eliminating of all third-party payers, including the government, and going back to the private practice of medicine. But perfection is expected in heaven, not on earth. So let's do a reality check. Here's some realities. Number one, everyone must get medical care, and someone has to pay for it. Number two, A large number of Americans love clinical medicine, like Kaiser. Number 3, too many Americans equate health insurance with actual health care. Number 4, too many Americans think they will always have Medicare. And number 5, too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. So let's talk solutions. If at all possible, we need our government to adhere to the KISS principle. Keep it simple, stupid. Simply put, only 3 things are required to provide good medical care. Number 1, health savings accounts. Money put into an account for payment of medical expenses and only medical expenses. No taxes at all, not even payroll taxes. Number 2, true catastrophic insurance. Insurance that covers only major illnesses, cancer, heart attack, stroke. Number 3, all medical expenses are deducted from the top of income, just like corporations do. The key, the absolute key, is that the HSA and the catastrophic insurance policy belong to the patients. If the patient changes jobs, the HSA and insurance policy goes with them. Therefore, pre-existing conditions are no longer an issue. President-elect Donald Trump is putting the necessary pieces in place, nominating Congressman Tom Price to be Secretary of Health and Human Services. In 2015, Tom Price introduced H.R. 2300. Here is a synopsis of that law. It's called Empowering Patients First Act. The act did not become law, but it will give us an excellent insight into Tom Price's thinking. Let's see how the new Secretary of HHS might address our reality check. Everyone must get medical care, and someone has to pay for it. Election of a tax credit instead of alternative government or group plan benefits, including Medicaid. In other words, block grants to where the patient can buy catastrophic insurance and fund an HSA instead of a huge Medicaid bureaucracy. A large number of Americans love clinical medicine like Kaiser. The provisions in Obamacare, which requires an insurance plan in ACA compliant, will no longer be in effect after Obamacare is repealed in its entirety. The patient can choose whatever form of medical coverage they want and are willing to pay for it. Too many Americans equate health insurance with actual health care. The emphasis on health savings accounts will put the doctor back to work for the patient instead of the insurance company or a government bureaucrat. Too many Americans think they will always have Medicare. This is simply not the case. 2 reasons. Number 1, Medicare is broke. Number 2, the left is pushing the public option. The public option is a euphemism for single-payer socialized medicine. If the public option is in place, everyone that is on any kind of government program, including Medicare, will be forced into socialized medicine. Think the VA hospital in Martinez. A person who is forced by law to be covered by Medicare can opt out and elect to take a tax credit instead to use to buy catastrophic and fund an HSA. Allow for the transfer of minimum distribution requirements from the HSA to fund the HSA. In other words, once you reach 70 and a half, you must take a certain amount out of your 401k or your IRA. Use that money without taxes to fund a health savings account. Too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. There is a large movement in the medical community to opt out of Medicare. In California alone, over 2,500 doctors have opted out of Medicare. Provision after provision of this law removes barriers between the physician and the patient. Provision after provision of this law forces insurance companies to compete for the patient's business, including selling policies across state lines. Competition always brings prices down. It is up to us, ladies and gentlemen, to ensure what replaces Obamacare is for the benefit of the patient, not the insurance industry. What can I do? Make sure you have the contact information for your representative in the House, Senate, and of course the President. On your speed dial, email, social media. Even have their snail mail address handy. Don't let them get away with kicking the can down the road. Make sure the patient is in charge. Remember, individual control equals individual choice. Ladies and gentlemen, there's a saying as old as time itself. He who pays the piper calls the tune. Thank you for your time. Individual control equals individual choice. Obamacare cannot be amended, tweaked, or adjusted. Repeal Obamacare, period.